to you about the vaccinations that you need for your children today. I heard you have a few questions.
Well, I've heard all these things from famous people about vaccines, um, how they don't work, how they cause autism, how, I mean, so can you tell me a little about that?
Yes, I understand your concerns with safety and vaccinations. A lot of parents who have children with autism are definitely looking for someone to pin that blame onto. I can tell you that in today's world, with there's so much information out there, it's very difficult to discern what is accurate and what is not. There is a group that was formed called the Interagency Vaccination Group in the early 2000s, and they studied 1 to 3 vaccinations each year to determine the safety and the risks associated with each one. Autism was very heavily researched in the years of 2000, between 2001 and 2004. They held open study groups as well as looked through all of the research to determine whether it could potentially cause autism. I can say that that theory, they cannot currently at this time find any link between a vaccination and autism. And the doctor who started the theory, Dr. Wakefield, has since been discredited for his research and lost his medical license because of his poor practices in research. So I would say that vaccinations are quite safe.
Are they necessary? I mean, if everyone else gets vaccinated, why do I need to get vaccinated?
That's an excellent question. Herd immunity, which is what people refer to it as, is very beneficial, especially for people with immunocompromisation who are immunocompromised. However, in order for herd immunity to take effect, you have to have 80% of the population immune to the disease. With today's climate, we see a decrease in people vaccinating their children, which is leading to higher incidence rates in some areas of illnesses such as measles, which used to be rare after the vaccination, but is now making a comeback. So herd immunity is not something I would rely on at this point in time.
But what about the cost? I mean, we don't have insurance.
That is difficult. Costs of healthcare can be quite difficult for many people. There is a program known as Vaccines for Children. It is typically started with groups like Medicaid and the Children's Health Insurance Plan, or CHIP. However, they did extend it out, and it now covers people who are uninsured or underinsured, so that they can make sure that all children receive their vaccinations. You can get those either at your pediatrician's office or the health department, or even they sometimes put up health immunization clinics at local elementary schools.
Okay. So I have a question. What about vaccination schedules? Do we have options? Because I'm kind of concerned about going in and getting a kid, my child, 5 or 6 shots all at the same time. So is there any?
Yeah, I understand the concern about doing so many vaccinations at the same time. However, research has not found that there is any value to increasing the length of time that you spread out those vaccinations over. It doesn't reduce anything. The level of toxins is actually quite lower than it used to be with vaccinations like smallpox. So you're just going to be putting your child at more risk for delaying those vaccinations than actually benefiting them.
Okay, I think I understand.
Great. Just so you know, if you fall behind or accidentally forget a vaccination and you come in for a sick check for your child, we can still give them the vaccination if it's just a mild fever, the sniffles, an ear infection, or mild diarrhea. Things like that will not affect the effectiveness of the vaccine and do not put your child at any greater risk. We are happy to help you whatever way we can. And if you have any more questions, please do not hesitate to let